We're at HIMSS 2015 talking with Ashif Jiwani, who's the General Manager for CSC Healthcare. Thanks a lot for your time, Ashif. Looking forward to talking to you.
Thank you for having us, Craig.
So, we're talking about wearable devices. There's been a proliferation of wearable devices over the past few years in a whole bunch of different varieties. Talk to us about how wearable devices can change health and clinical outcomes.
Yeah, it's a great question, and you're right. The mobile device industry started several years ago with cell phones, and that has moved on to what you might see this week, in fact, new devices like smartwatches being released by some really great companies. And there is a proliferation of devices, whether they be watches, whether they be glasses. In fact, even further than that, were clothes that you would wear that are self-energizing, to track your movements and track your... It's not as much about the availability of all of these amazing devices, but how do they get used in healthcare? How can they have a role to play in a person's health, their lifestyle, and their relationship with their physician, or even their loved ones who might want to keep track of their cholesterol or their blood sugars, etc. What we've seen is there is a dialogue, a conversation that now has to occur. A person who wears a wearable device is now able to track and monitor that person's behavior. What time did I wake up in the morning? How well did I sleep? How important is what I had for dinner last night going to determine how well I slept last night?
Interesting.
And so you have a sense of an ecosystem, if you will, of things that are communicating with other things, devices that are communicating with other devices, and the data that amasses, and how that data can be used by physicians, by nurses, by caregivers, by loved ones, to track behavior.